with me here we have myself, Ruhee, Claire, Nirushaa, and Abdullah, and we are the team for the CMHC project, and we're very excited to share with you our recommendations for how to best support affordable housing for Canadian seniors living in rural communities. So earlier this year, we were tasked with the question of how the Canada Mortgage Housing Corporation, CMHC, can support seniors who are living in rural areas to ensure that they do have access to adequate and affordable housing as they age and their needs change. So today we'll go through a little bit of our background of the problem, why it's as complex as it is, some recommendations, and then we'll close off with a discussion of next steps, and as Natalie mentioned, some questions. So the problem that's ahead of us, Canada's population is aging, and it's aging very quickly. So by 2036, seniors will make up 25% of the Canadian population, and that's double what it currently is right now. So as people age and their needs change, we also see a change in the types of housing that they need. And we need to ensure that there's enough seniors appropriate housing as demand increases. Right now, seniors living in rural communities, 17.5% of them live in homes that are either unaffordable, unsuitable, or inadequate, which is what CMHC refers to as core housing need. Because of seniors' unique needs, we anticipate that this is probably quite a low estimate, but of note is that approximately 60% of seniors who are within core housing need struggle with affordability specifically. 85% of seniors want to age in place, which means to stay in their own home as they get older. This is much easier said than done, and many seniors often have to move to long-term care facilities if they can't get the assistance that they need in home. This often means uprooting them from their communities, which has a significant impact to them, both financially as well as their mental and physical health. If they can't age in their homes, it's best if they can age within their communities that they've spent much of their lives in, as much of their support system is there. Right now, there are very few alternatives that allow seniors to age comfortably, affordably, and in their own communities. So this graphic provides a little bit of an overview of what the problem is exactly. So we can see that on the left side, seniors with a low level of need and therefore are quite independent, are able to age in place. Those requiring 3 to 4 hours per day can move into long-term care homes, which are publicly subsidized. But those with moderate levels of need actually have very few options unless they're wealthy enough to live in either retirement homes or to be able to move, which is often quite costly. Those two options are quite expensive as there's not that many units relative to the number of seniors, and many retirement homes are for-profit. For rural seniors, it can be particularly expensive because their homes may not have appreciated to the extent that they had anticipated, or to the extent of urban areas that they might be wanting to move to. I'll pass it over to Claire, who will talk a little bit more about framing the problem.
Thanks, Ruhee. So for some context, the vast majority of Canadian seniors, that's 93% of everyone over 65, live in private residences. As seniors age, as you can imagine, their needs evolve, however, and the share of seniors in senior-specific residences or long-term care facilities rises to 30% for the population over 85. Both aging in place, that is, aging in private residence, and aging in a senior's residence pose affordability challenges, however. For aging in place in rural areas, a major limitation is the availability of what the federal, provincial, and territorial ministers responsible for seniors describe as core community supports. These are home care services, so those are health related and include aid with personal care such as grooming, home support services such as cleaning and assistance with grocery shopping or meal preparation, and financial support such as programs that exempt seniors from property taxes, freeing up more of their incomes. In rural areas, home support services are most likely to be a barrier to aging in place. As seniors age and their mobility decreases, they generally require these services before they require regular medical and personal care assistance. Interventions that can decrease social isolation, an important determinant of health for seniors, can decrease the likelihood that they need other home supports. However, because home supports are not directly health related, they're not covered by provincial governments. And in low density areas, they may be either completely unavailable or prohibitively expensive. Senior needs regarding housing adequacy, that is like if the physical characteristics of a home are appropriate for seniors, may also be a barrier to aging in private residences. Residences may require renovations to, for example, widen doorways to make rooms more accessible for walkers or move bedrooms downstairs. So those are affordability challenges from aging in place, but there are also affordability challenges potentially for seniors who might be considering relocating to seniors residences. Seniors often receive support and companionship from local friends and family, and therefore prefer to be able to age in their communities where aging in place in their private residences isn't possible. However, there's evidence that rural areas are aging rapidly, which implies that there may be an insufficient supply of seniors residences in these areas. Residences that are available may also be unaffordable, as CMHC's Seniors Housing Survey demonstrates that lower cost units have lower vacancy rates than higher cost units in senior specific housing.
Thanks, Claire. So I'll talk a little bit about the elephant in the room, which is of course the pandemic, and how this has changed the trajectory of the issue. As you may know, the vast majority of COVID-related deaths in the last few months have occurred in long-term care homes. I think the number stands at about 81% right now. Trudeau came out just a couple of weeks ago saying that the current system of supporting seniors has failed. And he was very clear in it not being specific to COVID, but that seniors care has not been a priority to the extent that it needs to be. We anticipate that after the pandemic, fewer people will want to move to long-term care homes, which will further exacerbate the supply issue and will really mean that we need other options. We also think that the government will make care for seniors a higher priority in the coming years. And as we move forward with this, it is absolutely critical that rural seniors are not forgotten.
So in order to formulate our recommendations, we looked at different experiences across the world on aging in place. So we looked at 5 jurisdictions in North America and Europe. All of these countries have similar demographics to Canada, and all of them are OECD countries. So experiences and lessons learned from these countries are very much relevant to the Canadian society. So we identified from our analysis that different jurisdictions have key themes around aging in place. In Europe, the policies formed around aging in place are mainly focused around health. So there's a lot of focus on providing at-home personal and healthcare, and for ensuring the autonomy and independence of the senior individuals. Also in housing, they have support in form of social housing, which not necessarily geared towards seniors, can support seniors, and also co-housing, which is a communal housing where seniors share a living space with others, is also quite popular. In United States of America, there haven't been a lot of government-led programs for both seniors housing and health issues. However, the Fair Housing Act allows for the creation of age-restricted communities where every household residing in that particular community needs to have a resident aged 55 and above. Also in the United States, they have Medicare, which provides for health insurance for seniors. Whereas across the border in Canada, there has been recently a focus on creating more housing, and there has been some progress in home renovation programs for rural seniors. Across all these jurisdictions, the commonality was that their seniors have had access to health insurance and that they are long-term care facilities, both non-profit and for-profit, to cater towards senior needs. So our assumption is that due to the lack of housing and health options, the capacity of seniors to age in place is significantly reduced. and it also hampers their quality of life. So we propose that CMHC should begin by having a tailor-made strategy for rural seniors that involves allocation of resources for home renovation subsidies, promotion of alternative community-based housing, and also collaboration with municipalities, Canada Post, and Health Canada to deliver personal and healthcare at home. Going forward, we expect that these recommendations would reduce the number of seniors who are in core housing needs, and it would also lead to better health outcomes. And in the long run, we expect that seniors' capacity to age in place is enhanced and that they have a better quality of life. Now that I brought you up to speed with the broader framework of recommendations, I'll let Ruhee talk about the finer details.
So there are 4 categories of recommendations that we'll be discussing and highlighting. These include first, collecting and disseminating data to help inform policy decisions. Second, promoting health to help seniors age in place for longer. Third, supporting adequacy of housing to ensure homes are modified as senior health needs increase. Fourth, investing in alternative housing options to address a shortage of continuum of care and housing, to provide seniors with some needs a middle ground between housing where they live completely independently and long-term care homes for those with the greatest health needs. We'll go into depth for each of these recommendations, and we're going to start off with the first, which is collecting and disseminating more information.
All right, so our first recommendation is that CMHC collect and disseminate more information on rural senior housing need and rural senior housing generally. So something we realized as we began our research on this project is that there's currently limited information on the housing needs of rural seniors aging in private residences, and information about seniors residences from CMHC's Seniors Housing Survey is difficult to access. This may prevent policymakers from designing interventions to assist rural seniors aging in private residences and may contribute to an undersupply of retirement residences that appeal to rural seniors. Our recommendation is that we partner with Statistics Canada to design a survey of rural seniors in private residences about their housing needs. Some things that would be interesting to understand better would be how far from private residences seniors would be willing to relocate to a senior-specific residence, and whether a lack of affordable home support services might induce rural seniors to move to a seniors residence. The second part of this recommendation is making data from CMHC's Seniors Housing Survey easier to access. This is an annual survey conducted by CMHC that covers all seniors residences across the country and is an incredibly rich source of information on everything from the average size of seniors residences to where they're located, to what they charge in rents, to vacancy rates. CMHC recently made provincial data from this survey available in Excel tables, which offers users more flexibility than the PDFs the information was published in previously. However, since the program is a census, in theory, the data should be accessible in a format that can enable users to create custom tables. This would make it easy for developers to conduct market research and look for patterns that suggest that there may be excess demand for seniors residences in a region. For example, in a custom table, a developer could easily scan the country for regions where a lower than average share of seniors live in seniors residences and where vacancy rates in seniors residences are also low. The financial commitment required for both of these recommendations should be relatively modest, but we anticipate that providing better information to governments, nonprofits, and the private market may have an outsized impact on seniors housing. These interventions will also allow policymakers to better understand barriers to aging in place rural seniors face, and if necessary, zero in on challenges experienced by seniors with the lowest incomes. Developers could also feel more confidence investing in rural senior retirement residences if they had access to better data. So now Abdullah will discuss some things CMHC can do to partner with other organizations and promote the health of seniors aging in private residences.
So our research has shown that aging in place is a much more multidimensional and complex issue than just a housing problem. So we have identified that that social isolation and healthcare are one of the primary concerns of the seniors for aging in place, and that lack of at-home care and lack of socialization opportunities reduce their lead to deterioration of their overall health, and that reduces their capacity to age in place. We recommend that CMHC partners with Canada Post to start a program where postal workers working in their respective jurisdictions can visit rural seniors at their home, which can reduce their social isolation issues. This initiative has been tried in multiple jurisdictions across the world, including France, and the preliminary results are so far successful. Secondly, we would encourage that CMHC partners with provincial health ministries to transition to a home-based model where qualified physicians can visit seniors at their homes rather than having seniors travel to a health facility. This is one of the key components of the healthcare policy in Denmark, and we will strongly recommend that this is appropriate because that can improve seniors' ability to age in rural areas. Going forward, by the implementation of these recommendations, we would expect that the social isolation issues of the seniors would be reduced, and they will be able to age in place, and they will be able to lead a more healthier lifestyle.
Thanks, Abdullah. Currently, many seniors live in homes that don't currently meet their needs as they age. And so our third key recommendation centers around helping them age in housing that is in fact adequate. So, for example, seniors require modifications like widened doorways for walkers, grip bars in showers, and showers that don't require you to step over the side of the bathtub. Most provinces have programs that provide grants or loans for home modifications, but many of them do not cover rural areas. We therefore recommend that CMHC works with provinces to ensure that rural seniors are eligible for the existing programs. Ultimately, we hope that this will allow seniors to age in place affordably. It would allow them to stay in their homes and in their communities. It's a lot less expensive for them because they don't have to move. And as we talked about, it would improve their mental health, physical health, and sense of community. It's also less expensive for the government, as healthcare systems should see fewer falls, trips, and accidents that happen within the home. Earlier, we looked at this graphic and demonstrated the gap. So by working to improve seniors' health, as Abdullah talked about, and providing them with the funding for home modifications, we anticipate that seniors will be able to age in place even as their level of need increases. So as we can see here, they're able to age in place, but it still certainly leaves a gap. I'll turn it over to Nirushaa to describe how our final recommendation will fill this gap.
So our fourth recommendation is to invest in alternative and additional housing options to address the problem of lack of housing for middle and low-income seniors who are semi-independent, referring to those who need some care. Currently, the Canadian senior population is set to double by 2036, where 25% of the Canadian population will be over 65, and the number of seniors will quickly outnumber the available housing units. In 2017, there were 258,000 senior housing units in Canada, with new growth of housing units amounting to about 6.9% between 2007 and 2017. However, the senior population grew 21.7% over the same period. Hence, there were declining vacancy rates and rising average rent costs. In order to help address this gap, there are 4 housing additions and alternatives that can be developed and implemented in rural regions to help seniors. The first one is, it's called co-housing communities. So Co-housing communities are groups of 30 to 50 dwellings with a large shared kitchen, park space, guest houses, and community amenities. This is popular in places like Denmark, for example. Each unit is separate with its own bedrooms, bathrooms, kitchen, living space, laundry facilities, and often a separate yard. These communities have been established primarily in rural regions and are home to multiple generations. Co-housing has been found to decrease social isolation and has been a key determinant of health. Improving reported quality of life, fostering a sense of community, and allowing seniors to age in place. The second model is supportive housing, which is independent apartments for seniors that include access to services that are available for free or for a reduced cost. In this housing model, residents pay for their own rent. It's often set up in rent geared to income environments with controlled rents and tends to be run by governments or nonprofit associations. The third is retirement homes, which are often for profit and vary in cost depending on the accommodations, healthcare, and services offered. The care offered in retirement homes differs and varies depending on the home. They all tend to offer meal preparation, caregivers that provide help with everyday tasks, housekeeping, laundry services, recreational and social activities, medication management, and offer transportation to facilities for appointments. Historically, there has been a housing gap between the number of urban versus rural retirement homes that must be filled. Retirement homes are privately owned and therefore residents are responsible for most costs associated with living there. The fourth model is life leasing units. So life leasing units provide more mobile seniors who require less support with the stability of home ownership, an environment where accessing in-home support should be more affordable than in rural private residences. A combined life leasing and supportive housing model within a senior's residence can foster a greater sense of community because tenancy in these units is typically longer. So ideally, with these developments, there would be a mix of housing models in proximity so that seniors who require increased levels of care as they age, they don't have to move far or be displaced from their communities. In some cases, it may be appropriate to develop alternative housing in proximity to existing long-term care facilities. So overall, the anticipated impacts of adding these alternative housing units to rural regions include providing alternatives for seniors to age in community, which is overwhelmingly what they desire, and helps communities thrive as seniors tend to invest more within their communities economically than younger counterparts. And these additional units, including the services they will require, will increase employment prospects for families in rural regions, increase senior mental health, and mitigate rising costs of housing by increasing supply. So the next two slides really essentially show how alternative and additional housing models fill the gap between the aging in place for those who are more independent and aging in long-term care homes for those in need of more intensive care, providing options for those who are semi-independent.
Thank you, Nirushaa. So since all of these recommendations involve the utilization of taxpayer money, we would recommend coming up with quantifiable indicators so that progress against these recommendations can be measured accurately. In the short run, we would expect that by partnering with Stats Canada and by conducting surveys, there will be more availability of data on the housing needs of rural seniors, which would boost the creation of evidence-based policies. Also, we would expect to see a change in eligibility, and rural seniors would be eligible for housing modification programs. Going forward, in the medium term, we would expect that implementing these recommendations would reduce the number of seniors who are in core housing needs, and by providing them with better healthcare at home, there will be lesser hospitalizations of seniors, and eventually in the long run, we would expect to see seniors' capacity to age in place enhanced, and that their quality of life would improve. Last but not the least, all of these recommendations need to be thought of from a sustainability perspective. So we would recommend that there's sustained allocation of budgetary resources towards these recommendations so that the gains made by these recommendations are not lost. Secondly, as we have pointed out from the presentation, aging in place is a very complex and a multidimensional issue, and it involves collaboration between multiple jurisdictions and multiple layers of government. So we would suggest that going forward, federal and provincial governments collaborate for a more cohesive strategy on aging in place, and that any gaps arising from jurisdictional issues can be avoided. Third, we would recommend that the focus on senior care is diverted towards at-home care rather than long-term care, which can enable seniors to age in place. Finally, we would recommend that this current pandemic, which has exposed a lot of gaps in the senior cares, in the care of seniors, that this opportunity and this window is utilized to form policies that can support seniors to have better housing and health options that can enable them to age in place. Now I will turn to Nirushaa for the concluding remarks.
So we want to thank our sponsor, CMHC, for having provided us with the policy challenge, in addition to our coach, Mara, and our policy lab coordinator, Natalie, for all being available during this process for consultation and access to relevant material. Thanks very much to everyone who's been listening in on the presentation, and now we'd like to open it up to questions.
Thank you, Nirushaa. So we are going to now begin our Q&A. So if you have questions, you can either raise your hand with the little blue sign, or you can send me a message in the chat. We are going to begin with Tamara. I don't know if Tamara is on right now. I know she's having trouble with her connection in the last few minutes. And if Tamara is, there she is.
Can you hear me? I'm just trying to get my video on so that everyone can see me for a minute. Is that okay? Just while I ask the questions. Hi, guys.
That's great. Thank you.
Nicely done. Okay. So, Nat, do you have a recommendation? Do you want me to sort of
If you have
questions? Or do you want me to
if you have a succinct question that you would ask the team, go ahead, and then we're going to pass it off to Catherine and the CMHC team to also ask their questions.
Okay, so should I stick to one for now and then?
Just one.
Okay. So thank you for offering us a pretty thorough view of a lot of different issues that we need to consider for rural seniors. I do want to get back to this issue. You mentioned that we're in the time of COVID and that a lot has been exposed. One of the things that's come up a lot is that some of the issues we've been seeing in long-term care are a result of privatization. And in your report, you make the suggestion that CMHC should be looking at different housing options, but you don't really commit to, should these be not-for-profits, should these be private? Do you have a sense now that, do you have a sense in this climate around that issue? I mean, is there some concern around putting more money into for-profit retirement housing?
Yeah, thanks. That's a great question. It's very topical right now, and absolutely will be at the forefront of any decision that is being made. The federal government has indicated already that they are looking at developing guidelines. And so to date, a lot of that has been provincially regulated. And as I mentioned, Trudeau has come out saying that that has been inadequate. So we do anticipate the landscape to change. And I think that there will absolutely be more federal intervention going forward. I think it ultimately comes down to a trade-off of sustainability as well. And so we mentioned public-private partnerships as potentially an important place to kind of straddle the balance between having private investment that allows it to be fiscally prudent, where if we can attract private investment and don't need to spend taxpayer dollars, then that is absolutely an avenue that should be looked at. But conversely, to be able to partner with provincial and federal governments in a way that ensures that communities do stay safe. We also looked a little bit at, we selected communities in particular that would actually mitigate the spread of outbreaks. And so while a pandemic we're hoping we don't have another pandemic, the possibility of an outbreak is absolutely something that we do need to consider. So in terms of units like co-housing that Nirushaa talked about, where seniors have their own units, where they're able to, in many ways, age in place with access to greater supports, allows them to be able to isolate rather than be exposed in long-term care homes. And so to find ways to mitigate that, and the more that seniors do age in place with access to supports around them, the safer they will be from outbreaks in the future. Does that answer your question, Tamara?
Yeah, I mean, I think that you've just, your whole presentation, one of the take homes for me also was, we've got this silo way of thinking. We have housing and we have care. And for seniors, you got to put them both together.
Yeah.
And I guess I'm, just reminding all of us and just that when we think about housing, we can't forget about care. And there's been so much discussion around what happens when you put private ownership, when you put care in the hands of private ownership. Whether that's accurate or not, I guess remains to be seen, but I would suspect it's something to think about as CMHC is contemplating some of these different recommendations.
Thank you, Tamara. Thank you, Ruhee. I am going to pass the mic over to the CMHC team. If you could turn on your video and your mics. I saw Catherine, I saw Malcolm, I saw Elena, and I may have missed a few more. Catherine, why don't you lead the charge for the CMHC team, and then we'll pass it off to your colleagues to ask questions.
Sounds good. Thanks so much, team. I really appreciate the thoughtfulness of your presentation, and I think you've done a great job, creating, building the case for it, the evidence for it. We have very real demographic pressures here coming up, and a huge challenge ahead of us, I think. I think it's very helpful that you happen to be undertaking this work in a time when light really is being shone on just how critical the situation is for seniors. And long-term care facilities obviously being the most prominent, but I think we'll start to see divisions like between urban and rural becoming more apparent. So this was really timely and really appreciated. And I have to say, I really like your graphic. Just a small thing I wanted to point out to show how different interventions fill different gaps is really helpful. I'll have to make sure that the policy team at CMHC thinks about how we could use something like that when we're building our cases. So I was similarly to Tamara thinking about this conundrum of private versus public investment. I think your recommendations around data are very interesting, and you pointed out that it can help to make the case for developers to see where perhaps there's a need to fill. But on the other hand, I wonder, do we have the data to suggest that it's profitable to build private retirement homes, and can it be profitable and yet safe? So I guess that remains to be seen. What kinds of interventions? I think you're right. More perhaps regulation and guidelines would be helpful. And something I also wanted to ask you to tell me a little bit about your thinking on is, in this time of COVID, we're seeing maybe an opportunity for rural communities to have perhaps an influx of population beyond seniors. So I'm just wondering how you think that could perhaps support the mental health, well-being, and housing affordability more generally.
I know. So thanks for your question, Catherine. I think the second part of your question kind of hits on the first, which is we hope and we anticipate that potentially building more housing options for lower and middle income that gap will help attract urban to rural seniors, like people traveling from urban to rural, especially due to the COVID situation right now. There's also some evidence economically that seniors actually invest more within their communities, within their local communities than younger populations do. So already that's helping develop that area. And something else that we found is that having these different options actually created more job and employment opportunities for rural families within those regions, instead of it just being beneficial health-wise, mental health-wise for seniors. It's actually beneficial for families living in the region, and could attract people from urban settings in healthcare fields, social services, etc., to come and work in those regions as well.
So I see that we have two other members of the CMHC team. I see Malcolm. Malcolm, do you want to go next with your question?
Sure. With your question, maybe I'll try to slip in two questions maybe. But first of all, I should just say, just to, you know, similar to what Catherine mentioned, like it's been an absolute treat working, you know, on the few chances that I've had to speak with you folks. You know, you've really, you know, given me the opportunity to think about these issues in many different ways, and so I really thank you for that opportunity. So it's been very much a learning opportunity for me, even though I've been working in housing and very related subjects for a number of years. So I really appreciate that. And I also like the graphic. But I guess two things. One thing that just kind of caught my attention was the description of aging in place, and we talk about you know staying in the home. And I'm not sure if this is a question or a comment, but thinking about whether that idea could be expanded a little bit to thinking about aging in community, and whether we should be focused on you know the individual buildings themselves, or whether there's something at a broader scale that could be contemplated to address this, recognizing that this then does sort of amplify and you know create a much larger question and range of possibilities, different levels of government to work with, regulatory bodies, fully accepting that, but wondering if that might lead to some different outcomes. And the second piece was, and it's something that we may have discussed in some previous discussions, was obviously this is focused on a housing, it's a housing issue. And I think that you presented some very interesting things from that perspective. But wondering if also that some opportunities may be lost by not pursuing potential solutions in other areas. You know, I think we might have talked about, you know, changes to transportation and that sort of thing. Again, this was not kind of the focus of the main focus of your work, but wondering if there's some of those elements that I don't know if you want to comment on or not, but just it's just something that kind of rattles around my mind whenever I think about, you know, the rural versus urban challenge and how we can best provide, you know, especially when there may be kind of significant infrastructure and health related things that we're trying to resolve, if transportation or other mechanisms could be introduced also to sort of provide potential solutions.
I think that's a really interesting point about whether, like, to what extent it makes sense to prioritize aging in community here. And sort of the reason we chose to focus on that is because we know social isolation is such an important determinant of health for seniors. And we also know that a lot of seniors do rely pretty heavily on friends and family for support with sort of, they call them instrumental activities of daily living. So these are the things you might need help with before you need help with like personal care and grooming. So that's sort of why we like the idea of suggesting investment in like seniors' residences in rural communities. And it's sort of interesting to wonder if this is something that doesn't happen adequately. Like Catherine, you mentioned that it might be difficult for developers to understand whether a residence in a rural community would even be profitable because it's low density. You don't know whether seniors would be willing to move there. So yeah, that's why it would be important to understand whether, like how far on average seniors would be willing to relocate from private residences to a seniors residence in a rural community. And yeah, like maybe just, yeah, it's interesting that we believe that these things are that seniors residences in rural communities are undersupplied because rural communities can be quite inhospitable for seniors who are aging. So I think, yeah, the core of this one, I would say it comes back to the data recommendation a bit, about just making it like as seamless as possible for developers and policymakers to understand like what seniors aging in private residences want and look for.
Thank you, Claire. Thank you, Malcolm. Did anybody want to address the second part of the question? Because there was a more holistic part of the question, which was about, you know, and Malcolm, I have heard you bring this up in the last call back in June, which is how holistic do we need to take this issue? Ruhee, did you want to tackle that one?
Sure, I can. I think absolutely the more holistic, the better. The reality is the more holistic we go, the more complicated it gets. And so we as a team tried to straddle the line between working and partnering with other departments and also staying within the things that CMHC has scope over. And so as Abdullah talked about in our next steps, I think the biggest area in actually moving this forward is working with other organizations who have purview over things like transportation. And I think it has to be an all of the above solution. But if we presented you all of the above, it would be a very, very, very long report with very little in CMHC's sole jurisdiction. So I think one of our key recommendations is for rural seniors to be considered, rural seniors to be considered in the policy development across all fronts. And so I think working with other departments will be absolutely critical to moving it forward.
Excellent, thank you, Ruhee. I don't know what the D in Dhill stands for, but I'm guessing Dhill has a question for us.
Yeah, it's Duncan Hill. I'm with the Research Division, CMHC. I'd recently seen heard a study from, I think it was UBC, and they were looking at rural seniors' housing needs. And one thing they revealed was that many seniors are living in houses, in particular rural situations, that are overly large. In other words, they're mismatched for the size of the household, you know, 1 or 2 people in this rambling old farmhouse, or even a 70s house that they might have raised a family in at one point in time. There's the mismatch, but there's also a poor condition, and that they'd noticed that probably through the self-reported data and StatsCan around suitability or adequacy of housing is that just the physical condition is poor. So the salvageability with respect to retrofitting them for accessibility, you might wonder whether or not it's to the extent it's a lost cause. Number one, the house is inappropriate for the number of people living in it. Number two, houses can be in pretty crappy condition and it doesn't make any sense to put grab bars on walls that are falling apart because of mold. I'm wondering, in your work that you've done, because it's pretty substantive from what I can see, and I'm imagining we're only seeing the tip of the iceberg of the things that you guys have pushed your way through. But in the work have you done, did you get a sense around condition and mismatch challenges, especially when we're trying to, if you're targeting, extending the length of time people stay in homes?
I can take that if nobody else wants to, but I don't want to. I think you've hit on exactly the all of the above challenge that we have. That if we were to only provide modification options for seniors, those living in pretty rundown homes, you're right, the investment wouldn't make sense. But for a lot of seniors, their only option is to age in place or to move into long-term care homes. And so despite your home falling apart, you may decide that, well, I don't need 3 or 4 hours of care per day, so I'll just stay here. And in terms of kind of having this huge house that is falling apart, I think that hits exactly on the affordability challenge as well, where your house is probably actually not worth as much as you would need to be able to move into sort of a smaller inner city place, which, you know, we've talked a little bit in our conversations with UCMHC that in an ideal world, we could have more seniors at least have the option to be able to move into urban areas, but because of affordability challenges and that many of them do in fact live in places that are inadequate, that does present a more challenging landscape for seniors. So I think that's precisely why modifications is not our top recommendation. It will not solve the problem in it by itself, but given the demographic change and the fact that we will have twice as many seniors in a very short period of time who need access to adequate housing, that for seniors who are living in homes that do just need modifications, that those modifications would help alleviate the major demand concerns that we're about to see.
Thank you, Ruhee. Do we have any more questions from the CMHC team?
I was just curious to pick up on that, you know, that growing number of seniors. Have you seen projections around how many are likely to be low income and in need of supportive housing like this?
No. We looked for projections about growth in the senior population in like rural versus urban areas too, and we weren't able to find that. But yeah, that's an interesting point.
But I think that's where the first recommendation comes in, where we're missing a lot of critical data that I think we've kind of fleshed out in the report that we would need, and CMHC needs to kind of get down to what recommendation can work best.
Yeah, for sure. Important to have the information to be able to make the case.
Thank you, Catherine, for that. Elena is on our screen. Elena, do you have a question or a comment for the team?
Yes, thank you. I have a quick question, and it's about one of the recommendations, the first one, which is about the data. We spent quite a lot of effort developing various sources of data, and what we often kind of face is, okay, it's a lengthy process. It's also a very costly process. And once the data is developed, it's not always easy to actually disseminate the data and communicate what exactly data shows to others. There is certainly interest from research community to look at the data, but to broader audiences, it's often quite difficult to convey the meaning of the data, and also difficult to engage them in consideration of the data. So I'm just wondering if you've kind of given it some thought, what would be an efficient way to disseminate those data which you recommended would be collected, so that they would reach a wide audience, not only researchers who are kind of keen on crunching the data. And also another kind of aspect of data which we face quite often in our work is that well, data collected through traditional methods, like going with Statistics Canada's surveys, or even surveys which we do at CMHC, they are to an extent static data. They are collected for a specific like date or period of time, or even a year, and then for a longer period of time they do not change, so they do not allow us to see the dynamic of what is happening well, with housing conditions with individuals and households. So I'm wondering if through your research you came across some examples that maybe some form of crowdsourcing data or big data which are much more dynamic, that are used for the purposes which you've suggested in your presentation.
I can speak to that one a bit. I think that's an interesting point about the challenge of disseminating data, especially if it's from a survey. You have to kind of like make sure that what you're saying is actually statistically significant if it's based on like a sample. And I know, as we're all aware, Statistics Canada would sort of do that for you, but I think like thinking about how to disseminate, it's good to do that at the beginning, because it kind of tells you, you can kind of work out with stakeholders like policymakers and developers even, what sort of things they're interested in at the early stage, and then just make sure you give them exactly that, like in a report. And obviously if it's a survey, it's just going to be a one-off like static thing, but I would focus more for that on senior preferences, like how far they would be willing to move to a senior's residence if they're in rural areas, more so than on things that might vary by region, like availabilities of home supports, which we've discussed being a challenge. Yeah, as for your second point about challenges of basically survey data that sort of take a snapshot, that's why I think the seniors housing survey is such like an interesting tool to build off of, because it's a census, so you could like make it available in custom tables and just make it quite flexible for people to work with. And CMHC does it every year anyway. So that's sort of the source that allowed, Nirushaa cited a DBRS report that said like, or CMHC may have said this too, but it looks like growth in the senior population is like really outstripping growth in like these units. And you're able to do that based on that source because it's like every year and is sort of like consistent. Big data stuff, we didn't really think that much about, but it's like you have a really good tool there, I would say, for market research.
Thank you, Claire. Thank you, the CMHC team, for all of your great questions. You make this session even more special by participating and asking questions of the team. We are now going to move on to the faculty. I have one question from Chris, and we may have room for one more question depending on how long Chris's question is.
Thank you. Great job, team. Like everybody else who has spoken, I really liked your graph of the gap. And as I was looking at that, more or less the first thing that occurred to me was I wondered how much of this problem, I'm pretty sure it can't be all of it, but how much of the problem that you're addressing could be solved by giving elderly people more income. So 40 years ago in Canada, if you ask people that are even older than me, they will tell you that there was a poverty problem among seniors. In fact, it was inelegantly and insensitively, but rather effectively called the dog food problem, because we had a lot of elders in this country that were so poor that they were eating dog food. So OAS is there, the GIS, the Guaranteed Income Supplement, is there. And kind of 20 years later, we thought, okay, we've solved the dog food problem. We actually no longer, we had massively reduced poverty among seniors. And I guess my question is, how much of this problem could be solved by having a rural supplement to the GIS, or just increase the GIS, or make the OAS more generous? I'm sure it can't solve all of these problems, but and I know that that's outside of CMHC's scope for sure, but just knowing what this problem is now, how much of it could be solved by putting demand in the hands of the people, who are living in those homes?
So as we said in the presentation, the aging in place problem, it's quite complex, and it doesn't involve housing only. So by improving their income, their capacity to afford housing can be increased, and their capacity to renovate their homes, that can be increased. But other issues such as social isolation and at-home care, they won't be that much affected by that. And also, as seniors age, their ability to perform different physical and mental functions deteriorates. So that gap cannot be fulfilled by income. That needs to be fulfilled by having supportive measures in the place, or having, for example, if they grow old, they cannot go out for shopping themselves or drive a car by themselves. So you need those measures in place to help them as their capacity to perform motor functions deteriorates.
So quick follow-up then. If your sponsor had been CMHC and finance, would you have added to your recommendations that we you know, increase the GIS, or that we increase, you know, put in a rural supplement for the GIS, or would that have been something that you would add?
Well, in some cases, there are issues where seniors are, they have affordability issues and they are unable to modify their homes for, to make them fit for purpose for elderly use. So in that case, yeah, like if there was provision for increasing their income, yeah, that would have helped. But for the social and the health aspects, not that much. But like, yeah, for like improving their housing conditions specifically, yeah.
Thank you, Abdullah. See, Chris, money doesn't solve everything.
Maybe just to add to that.
Things.
We have time for one last question. Jennifer, do you want to take us for our last question for our last session of the day?
Sure. I want to get back to this question of data. And I'm sitting here wondering, I could be wrong, but you guys have looked at it, whether there are actually special problems around gathering data in this policy area, given that, I mean, you see it in voting, people will give you their preferences, but they don't actually always do what they say they're going to do, right? And here I wonder if, because the situation for seniors can change so radically, they may think or want that they're going to take a particular path, but something may happen that changes what's possible for them very quickly, or they may not be making the decision in the end. And so I wonder if there's a danger in gathering data through this traditional method of thinking you're going out and asking them preferences, whether in fact we may not need to match that with really good analysis of what people actually do, which means we may need to be 5 more years into this before we have really a reliable picture, or maybe 10 years into this. So we're looking backwards as well as forwards, because I worry that the preferences that might be stated may not in fact be in all cases matched with what people actually do. And I wonder if you thought about that at all.
That's a really good question. Like the CMHC has actually done some work that we found on like examining push-pull they call them push-pull factors about like what might induce somebody to move out of a private residence, and which one of them are the strongest predictors of like moving in 5 years. And yeah, they had a bit of a hard time in this like technical analysis finding anything like truly predictive. The data recommendation is just sort of, we just imagine that it's tough to age in rural areas in like a private residence, but don't see enough development of seniors residences, despite the fact that we also think they would like to age in community. So that was just sort of to get at the idea that like maybe there is some sort of market failure that we're not understanding, or developers are just like could use like more information on this population specifically, which has like very specific reasons it might be difficult to stay in private residences, that could be sort of like making them gun shy about investing. So that's a really good point.
No, very interesting. Thanks a lot. It was very thoughtful, you guys. Thank you.